A very good evening to all of you. Today we are going to do the Neet PG MCQ challenge for radiology. Radiology is a fantastic subject and it carries a very good weightage in the Neet PG as well as the NACT exam. Most of the questions of a radiology, some questions appear directly in radiology, some in surgery, and some in medicine. So, if you are well versed with this subject, you will be able to answer a lot of questions. So, let's begin with the first question. Which of the following is the most likely diagnosis of patient with following chest X-ray? A. TGA, B. TAPVC, C. TOP, D. Epstein anomaly. Look at the X-ray very carefully and tell what is the diagnosis. Your time starts now. It is tetralogy of Fallot. Now you can see a boot-shaped heart here. Well, it is the only cyanotic heart disease that may present in adulthood. X-ray finding here you can see boot or wooden shoe-shaped heart, which is also called as Corin Sabbat. Clear hilar areas and lung fields. Clear hilar areas and lung fields because of diminished pulmonary blood flow. Large aorta and a right-sided aortic arch. ECG corresponds to right ventricular hypertrophy and right axis deviation. Transposition of great arteries. In transposition of great arteries, you can see egg on side or egg on string appearance. In supracardiac type TAPVC, you will see enlarged heart, which is termed as figure of eight and snowman. In partial anomalous pulmonary venous return, what you will see, please comment in the chat box. In Epstein anomaly, you can see box-shaped heart. So it is boot-shaped heart and it is tautology of Fallot. Uh, which sign is seen on USG ultrasonography when the femoral vein meets the great saphenous vein and femoral artery at the saphenofemoral junction? You can see in the image clearly and find out what it is. A. Mickey Mouse sign, B. Tilloch sign, C. Stemmer sign, D. String sign. So the correct answer here is Mickey Mouse sign. Why Mickey Mouse sign? Mickey Mouse sign represents the normal anatomy of common femoral artery, common femoral vein, and the great saphenous vein on ultrasound at the level just inferior to the inguinal crease. Now, regarding the other signs given in the options is Tilloch sign. Tilloch sign is a clinical sign in which there is a resonant area between the pubic bone and tumor, indication that the tumor is mesenteric. Then stemmer sign. Stemmer sign is seen in lymphedema. Skin on the dorsum of toes cannot be pinched due to subcutaneous fibrosis. Then string sign. String sign is seen in Crohn's disease. String sign is seen in Crohn's disease. So the correct answer here is Mickey Mouse. Radiation dose monitoring in occupation of a personnel is done by A. Linear accelerator, B. TLD batch, C. Gamma camera, D. GM counter. Here, the correct answer here is TLD patch. What is TLD? Thermoluminescent dosimeter is a passive radiation detection device that is used for personal dose monitoring or to measure the patient dose. TLD is used to measure external individual doses from X-ray, beta, and gamma radiation. It consists of TLD card loaded in a cassette having suitable metallic filter. It is based on phenomenon of bioluminescence, the emission of light when certain material are heated after exposure to radiation. So the correct answer here is B. Remote after loading dose is used in A. Brachytherapy, B. Electron beam, C. Proton beam, D. Cyberknife therapy. The remote afterloading dose is used in brachytherapy. It is a situation in which a radioisotope is placed onto or inside the patient. The radiation source is sealed in a protective capsule or wire, which prevents the radioisotope from moving or dissolving in body fluids, but allows the emission of ionizing radiation to the surrounding tissue. The source can be placed into target tissue or the tumor itself, such as the prostate or breast, into a body cavity, such as the uterine cavity, esophagus, or bronchus, or onto the skin surface to treat a cutaneous malignancy. Brachytherapy applicators have been adapted to enable better imaging. For example, CT and MRI compatible intrauterine tubes have been developed for gynecological treatment. So the correct answer here is A. Brachytherapy. Identify the given X-ray abnormality: A. Costochondritis, B. Cervical rib, C. Rib fracture second and third, and D. C5 C6 spondylolisthesis. It is a cervical rib. You can see the image very carefully. You will find it is a cervical rib. In which of the lung pathology MRI is preferred over CT? A. Pulmonary embolism, B. Tuberculosis, C. Pancreas tumor, D. Pleural effusion. Well, MRI is preferred in case of Pancreas tumor, so the correct answer here is C. Pancreas tumor. DSA angiography image is shown below. What is the diagnosis? A. Pseudoaneurysm of ICA, B. Angiofibroma tumor blush, C. Multiple hemangiomas, carotid cavernous fistula. The image is showing a well-defined outpouching from cervical portion of internal carotid artery. This is typical of a pseudoaneurysm, and the image almost remains the same for pseudoaneurysm in any other part of the body. So it is pseudoaneurysm of internal carotid artery, which gives a negative test on FDG PET test. A. Small cell carcinoma, B. Large cell neuroendocrine tumor, B. C. Typical carcinoid, D. Atypical carcinoid. FDG pattern carcinoid that is comprise 1 to 22% of all lung malignancy. They are a part of spectrum of pulmonary neuroendocrine tumors of increasing malignant potential, ranging from low-grade typical carcinoid through intermediate grade atypical carcinoid to more malignant large and small cell neuroendocrine tumor. Typical carcinoids have low glucose turnover, therefore 18FG, FDG PET is not useful. So the correct answer here is C, typical carcinoid. Investigation of choice for detection and characterization of interstitial lung diseases: A. MRI, B. Chest X-ray, C. High resolution CT scan, D. Ventilation perfusion scan. It is high resolution CT scan. Please click the link in the description box to join the ultimate Neet PG breakthrough blueprint. It will be very beneficial for you as far as all the 19 subject revision is carried on in just 2 days. And the first 10 people who click the link in the description box will get this masterclass of 2 days absolutely free, and it is a live online class. What is a probable diagnosis? A. Thymoma, B. Mature teratoma, C. Aortic dissection, D. Lymphoma. What is a thymoma? Thymoma is a tumor originating from epithelial cells of thymus that is considered a rare malignancy. Thymomas are frequently associated with neuromuscular degenerative disorders such as myasthenia gravis. Thymoma is found in 20% of patients with myasthenia gravis. So the correct answer here is A. Thymoma. A middle-aged male patient presents with fever and diarrhea for 1 week and acute onset pain abdomen for hours. An erect abdominal X-ray was taken as shown in the below. What is the probable diagnosis? A. Appendicitis, B. Perforation peritonitis, C. Toxic megacolon. This film shows a dilatation of transverse colon and descending colon with loss of hostrations. Radiographic features of toxic megacolon are dilatation of transverse colon at least 6 cm or more. There is a loss of hostile markings with pseudopolyps often extending into the lumen, thumb printing from mucosal edema, etc. So the answer is toxic megacolon. In coarctation of aorta, rib notching is seen in A. Third to ninth rib, B. First to ninth rib, C. 11th and 12th rib, D. All ribs. So, what are the radiological findings in coarctation of aorta? Widening of left subclavian artery border is the most common finding. Widening of left subclavian artery border. But the most useful radiographic sign is an abnormal contour of aortic arch, which may appear as a double bulge above and below the usual site of aortic knob. This pattern has been described as figure 3 sign. Rib notching occurs along the inferior margin of third to ninth rib. It is caused by pulsation of dilated intercostal arteries. This third to ninth. 20-year-old male presented with knee pain on movement and X-ray showed a lytic lesion on the upper end of tibia. Identify the lesion. A. Tibial giant cell tumor. B. Adamantinoma. C. Simple bone cyst. D. Ewing sarcoma. Well, it is a tibial giant cell tumor. Giant cell tumor is also called osteoclastoma. The peak incidence of giant cell tumor is seen in the third decade of life. The most commonly involved location include the ends of long bone, distal femur, proximal tibia, distal radius. Roughly half of all cases occur around the knee joint. Sacrum is another common location. Plain radiograph shows an expanding lytic lesion, also called soap bubble appearance, in an epiphyseal location extending to the articular cartilage. So it is a tibial giant cell tumor. Judet view of X-ray is for A. pelvis, B. calcaneum, C. scaphoid, D. spine. View from the image you can see from the X-ray you can see the Judet view. It is involvement of pelvis. The correct answer here is A. pelvis. Puff of smoke appearance again most commonly asked question in cerebral angiography. You can see there is a puff of smoke appearance is seen in A. Moya disease, B. Cavernous sinus thrombosis, C. Cerebral infarction, D. Carotid artery thrombosis. Well, it is Moya disease. What is Moya disease? Moya disease is a progressive occlusive disease of cerebral vasculature with particular involvement of circle of Willis and the arteries that feed it. Cerebral angiography is the criterion standard for the diagnosis of Moya disease. Important point, small abnormal net-like vessels proliferate, giving the characteristic puff of smoke appearance on direct angiography. FAST stands for A. Focused assessment with sonography for trauma. B. Fast assessment with sonography for trauma. C. Fast assessment with sonography and tomography. Focused abdominal sonography for trauma. It is focused assessment with sonography for trauma. So the correct answer is for fast. Which of the following gland tumor produces hot spot on technetium 99? M. Purpura technate scan. A. Adenolymphoma adenoid cystic carcinoma. D. C. Adenocarcinoma. Pleomorphic adenoma. It is adenolymphoma. Investigation of choice for leptomeningeal carcinomatosis is PET, SPECT, GD enhanced MRI, CT scan. It is GD enhanced MRI. Which of the following is used to differentiate between epidermal cyst and arachnoid cyst? Contrast enhancement, T1 MR sequence, DW1 MR sequence, smooth margin, DW1 MR sequence. Which artery is associated most commonly arteriography by femoral artery? Is celiac trunk, superior mesenteric artery, inferior mesenteric artery, gastroduodenal artery? It is inferior mesenteric artery. Please click the link in the description box to join the ultimate 2-day NEET PG masterclass. It will be very beneficial. It is your gateway to NEET PG success. The first 10 people who click will get this class absolutely free. Let's move to that. Radiation exposure is the list in the following procedure. A. Micturating cystourethrogram. B. IVP. C. Bilateral nephrostomogram. D. Spiral CT. So it is micturating cystourethrogram. Frontal sinus can be best visualized by A. Caldwell's view, B. Waters' view, C. Townes' view, D. Schuller's view. It is Caldwell's view. Cerebral blood flow in an asphyxiated child is best measured by NIRS, B. PET, C. Radionuclide imaging, MRI angiography. It is NIRS. Agon side appearance is seen in A. TOF, B. TAPVC, C. Uncorrected TG at Ankasatorosis. It is uncorrected TG. An absolute contraindication of MRI is A. Pacemaker, B. Prosthetic cardiac valve, insulin pump, cochlear implant. Now, absolute contraindication for MRI include cardiac implantable electronic device such as pacemaker, ICDs, CRT devices can malfunction during an MRI. Metallic foreign objects in eye, objects near the eye can be seen on an X-ray, and implantable pediatric sternum devices. These devices are not compatible with MRI. Other contraindications include bullets, sharpness, metallic fragments, some vascular clips. Some medication pumps, some cochlear implants, neurostimulation systems, catheters with metallic components. The correct answer here is A, pacemaker. Hampton hump is a feature of A, uh, pulmonary tuberculosis, B, pulmonary embolism, C, pulmonary hemorrhage, bronchogenic carcinomitis, pulmonary embolism. Most sensitive sonological indicator of aneuploidy is A, gestational sac, volume, crown dump lengthness, neutral translucency, serum beta HCG level. It is neutral translucency. The gold standard for diagnosis of osteoporosis is dual energy X-ray absorptiometry, single energy X-ray absorptiometry, ultrasonography, quantitative CT. It is dual energy X-ray absorptiometry. Maximum permissible radiation dose in pregnancy is A, zero point 0.5 rad, 1 rad, 1.5 rad, 3 rad. It is zero point 0.5 rad. I wish you all the best. Best of luck for your NEET PG exam. Please attend these sessions live. Please like, share, and subscribe. And also click the link in the description box to join the ultimate 2-day NEET PG Breakthrough Blueprint Masterclass. Wishing you all the best. Meet you in the next live session.